Hello, everyone, and welcome to another webinar for our series here this summer, looking at different DPCs and how people got involved. We are super excited to have you today. I am going to give people about 2 minutes to get in here. I know a lot of you join us on your lunch breaks, and for those of you who are joining after it's already been recorded, you can feel free to fast forward to, to 3 minutes in, and we'll get going here. My name is Sarah Harker, and I'm the Business Development Manager with Freedom Healthworks. I came to Freedom with a background in nursing. The majority of my background is cardiac nursing, and I actually left the floor about 6 years ago and started a company to help prevent burnout in healthcare. And I like to say that was kind of my gateway drug to Freedom Healthworks, because what I realized there was quickly that I could help teach people different tools they could use to help prevent burnout, but I couldn't actually remove the barriers that were causing it. So enter Freedom. I had a friend that worked at Freedom and mentioned I should meet them and see what everyone is about. And I drank the juice, and I've been here ever since. It's been an incredibly fulfilling career for me, getting to not only help people prevent burnout, but actually remove the barriers that are typically coming from insurance companies and administration that are causing the burnout in our healthcare providers today. So we have been focused on keeping more of those docs in the medical field as much as possible, because we don't want the good people leaving, for sure. And that's a perfect segue to Dr. Schumacher. He has been a friend of Freedom Healthworks for a long time, and we've been a fan of Dr. Schumacher's for a long time. So I'm really excited to talk with him today and for you all to get to meet him and hear more about his journey in DPC. So welcome, Dr. Schumacher.
Thanks, Sarah.
Yeah, I'm so happy to have you today. I can't tell you how many phone calls I get about rural healthcare and if direct care will work, or if it's just for an affluent community, and all of these things. And you're such an expert. So I'd love for you to fill us in a little bit on your background and how you got to DPC.
Great, thanks. I don't know that I'd call myself an expert, but I guess I've been into this about six, close to 7 years now. And so I guess I'm a few years ahead of some of the other people doing this, but that is one of the cool things about direct primary care. Is it seems like I'm not a Freedom Docs or a Freedom Healthworks doctor, but I've known Chris and about your organization for quite a long time, and we want each other to succeed because it's best for doctors and it's best for patients. So I trained at St. Vincent's there in Indianapolis, and did my family practice residency there. And I'm from a smaller town in Indiana, and I thought I wanted to go to a town of about 5,000 to 15,000 people. It seemed like an ideal setting, what I was used to growing up, and just a lot of freedom to practice as a family doctor in that setting. So I moved to Plymouth, joined a typical kind of a hospital-owned practice, a guy who wanted to start to semi-retire. And everything was beautiful at first. And often the case is, you had that honeymoon period and they were hands off. It's great. Things were going well. But then as the hospital sold and, the CEOs change, things can change. And yeah, I think the turning point for me, so I was in fee for service here in Northern Indiana, a small town of Plymouth, for about 17 years. But the last 5 years, it was a struggle, just to go to work. It just wasn't so much fun. And a couple of turning points, I think, for me in the office. I walked out of the office one day, out of my room, and I just saw people everywhere. I mean, there's 4 doctors, 4 nurse practitioners, a dietitian. So on the surface, we looked successful because we were growing the practice. But I mean, the tail was wagging the dog. It was crazy. It was out of control. And I'm like, I can't keep doing this. And then one day, I guess this is the major turning point. One day I came home, and usually after seeing patients, you're trying to get all your emails and your check boxes done and some of your charting, and you never get it done. You go home and do some more at home. But I came in the house, and everybody's eating again, my kids. And not meaning this in a bad way, but my wife said, I apologize. I thought I'd be home earlier. She's like, it's okay. We just are learning just to do life without you. And when you show up, it's great.
Ouch.
And she didn't mean it badly, but that is not the husband, father person I wanted to become. And I'm like, what's going on here? But I didn't know what else to do.
Right.
And so, as somebody called me and said, hey, we want to open some near site on-site clinics in Northern Indiana. And it was kind of a scary thing because I'd never known anything other than being employed by a hospital. But I
Mm.
took that jump, and so I worked for 4 years in an on-site, near-site clinic in Valpo and in Maryville. And what I found was I had enough margin and time to start to do a little research and started finding out about direct primary care and realized what I was doing in these on-site clinics was similar, that I didn't have to go through all the insurance loops and jump through all their hoops. I had more time with patients. Patients were happy. I was happy. The nurses were happy. And then I realized this thing called DPC allows people to practice sort of that way, but in their own hometown or with just the individuals without just the company structure. And
Yeah.
so I made that leap, and it was kind of scary at first, but it's been great. Don't look back. So that's how I am where I am. I'm in Plymouth, right downtown. It's a town of about 9,000 people. And
Mm.
we've been in this for almost 7 years, and we've grown. We're full. We closed our practice actually about 2.5 years in, and we have a
Wow.
waiting list that we've been building. So um, here I am.
That's awesome. And so in your practice now, are you a one-man show? You said us, so I'm assuming you've got a few other people in there now.
Yeah. So I started out with, well, about 2 months before I opened, I had a couple of town halls, and people would come to find out about direct primary care and what I was doing. And I was able to build up about 70 or 80 patients before I even started. So on day one, I had about
That's
80
great.
paying patients. So I hired a part-time medical assistant. So it was just she and I at first. She worked 4 days a week and did everything with me. And then about 4 or 5 months in, I hired another nurse.
Mm.
And then that first medical assistant went back to her old job, and I hired another one. So I have two full-time staff now, a nurse practitioner who functions more as my office manager. When I'm gone, she'll see patients, but she doesn't have her own panel. And then I
Okay.
have LPN who's at the front desk, but we do a lot of cross covering, drawing blood and doing vitals and things all together. So it's just the three of us, small
Awesome.
practice. I guess one of my challenges, I'm jumping ahead. Maybe you were going
Yeah.
to
No,
ask
you're
one of
fine.
my challenges, that because it kind
Yeah.
of
Take
segues
us where you
right into
want.
that, is how do you grow? You
Yep.
know, that is tough no matter what model you're in. And when I came to Plymouth, it was just me and this older guy, and we hired one guy, and everything was great. But as it grew, it just became sort of unwieldy.
Mm.
Then I went and I did that on-site clinic thing for 4 years. And when it started, there were about 40 employees statewide. By the time I left, it was about 130, and they were growing in different states, and they just got a bunch of venture capital money. And again, it was sort of getting out of control. So I'm at a point now where I need to grow my practice because our community needs physicians. I mean, if
Mm.
somebody would come here, they would have a pretty quick practice if they wanted to. But
Mm.
on the other hand, I'm a little fearful of growing my practice too quick because I don't want to go back there again. So I'm trying to figure out how to grow in a good way.
Yeah, interesting. I think the question that I don't see any questions in the chat box here. I forgot to mention that at the beginning. There's a Q&A box for those of you who are with us live. Feel free to throw your questions in there and we'll get those to Dr. Schumacher. But I'm guessing what our first one will be is, how did you know when you were ready to hire? That's usually what people are wanting to know when they find out you're more than just a one-man show. What was the point where you knew, okay, I need more staff?
Yeah. I think because I was able to do some signups before day one, and I knew how many patients were going to be paying monthly, and I could figure out what that was. I knew I
Mm-hmm.
could afford to have a part-time MA right from day one.
Yeah.
But that means there was one day I was there that I didn't have someone with me. So I answered the phones and I did everything myself. I know some DPC doctors start out and it's just themselves and they just keep it that way. And some of them will keep only maybe 200 patients and they want to keep a micro practice like that. And that's
Mm.
great. And that's one of the beauties of DPC too, is you have a little more freedom to
Yeah.
design it how you want it to be. What's best for you, your family, what's best for the patients. And so just keeping an eye on those numbers, when I got to a certain number and I saw I was covering her salary, and then I could start taking more of a regular salary,
Yeah.
and the growth continued, then I just kind of went that way. So just followed the numbers. And
Yeah, that's awesome. I like how you said that, because you'll often hear us say on these webinars and anywhere in the DPC world where you go, that if you've seen one DPC, you've seen one DPC, because everyone is so different and you truly can customize it to be whatever it is that you're looking for. just like we see great success in big booming cities and we see great success in rural communities like yours. So I'd like to talk a little bit more about that community. We have a question here asking about marketing efforts and outreach efforts that you've deployed in your start of your DPC. And I'd like to add on to that a little bit of if you've done anything differently for the smaller town that you're living in that than you would do for a bigger city.
Yeah. I think, what I'd say is it takes a little patience.
Yeah.
I think word of mouth, and everybody probably has heard this, word of mouth is the best, but word of mouth is not very fast. People want to go home and tell their neighbors and friends, but they get home and they're hit with 100 things and they don't. And then it takes several times. But once that starts getting a foothold, that's the best. I did a couple of town halls early and explained it to people. And I think those people went out and talked. I did a lot of Facebook. I got a web page probably about 4 months before I opened. And then I could start directing people to that web page so they could read about it. And then I did a Facebook page and just did some posts, and people really like that and get a personal touch to it, and they would share that. Those were probably my major marketing strategies. In my experience, trying to run ads like in newspaper and radios weren't that helpful, really. And I know you guys and you people can find out about Freedom Healthworks. If people choose to work with you, you do a lot of marketing for them too.
Hey, I like that plug. I'll take that plug any day.
Is that the experience you have too, though? Is just a lot of radio and newspaper doesn't seem to work as well, and it's more the social media and
It's
word of mouth.
dependent on the community for sure. So it's dependent on that definitely. You mentioned at the beginning that we actually didn't help you launch your practice. You somehow did this on your own. And I always like coming back to that and saying, just like what you said of you, no matter how you do it, we're here for you. So that's a really cool thing about direct care is that we're a very collaborative community. So while Freedom is here to offer you support and to take on some of those business difficulties and pain points, and we can get you started, you don't have to do it that way. There's lots of different ways that you can do it. Freedom exists so that we can support you and get you going as quickly and efficiently as possible. So sometimes people don't have multiple months to wait to get to that place where they're taking an income, and that's why we exist. So if that's something that you're interested in, thanks for the plug, Dr. Schumacher. We can definitely help you with that. Marketing is a big piece of that. And it is very specific to the type of community that you're in. We see, direct mail and postcards and town halls do really well in smaller communities. I'm curious, did you host your town hall at your office, or was there somewhere in the community that you hosted?
There was a kind of like a little, I don't want to call it a convention hall because this is not like Indianapolis, but someplace where 100 people could fit.
Yeah.
And we just leased that out, and we had somebody who makes homemade cookies and things. We just had some snacks.
That's awesome.
And it was great. And I had a little PowerPoint, presentation that took like 15 minutes and then 45 minutes for question and answer. The other thing, and kind of back to DPC doctors, as a rule, they want to see each other succeed, because the more people understand the model, I just think is better for patient care. And if we really care about patients getting good care and not being rushed through and getting shafted, we want them to have a DPC doctor. So as much as we can, we will help each other. And when my practice got full, I've had a few other DPC doctors who were in the planning stages come and spend a day with me or talk with me. I'm happy to do that. But there's one in Rochester who's about a half hour south of me, Dr. Schumacher, and she opened about a year ago. And when we have people call us, we give them her name because we're full. So I know she has had a lot of calls there. Or if I have someone who moves to another part of the state, I'll find out who's practicing in that area. So there's a lot of self-referral too that can kind of help to build your practice.
Yeah, I love that. I think it's really important to know, most DPCs are taking 500, 600 patients for their panel tops before they're adding in a nurse practitioner or a PA or even another MD in the practice. And so when you think of competition and you're starting a new business, people automatically think, well, I've got to go check and see who else is around competing. And it's actually very different than that. It's, we're building each other up. The more that there are DPC offices, the more that patients know what DPC is, and the more that we can help move healthcare to a safer place for both physicians and for patients. So yeah, I think that's such a great point. And it looks like someone else asked a question that was right on there. Okay, someone asked, How do you explain in layman's terms what DPC is to an unfamiliar audience or person? So I'm guessing they're thinking more about like when you were opening and introducing this idea to patients. Do you have any phrases that have resonated with them?
And you probably have heard this before, but sometimes we'll talk about it's kind of the Netflix for doctoring, because people get that. They maybe pay a Netflix subscription monthly, but that doesn't mean they're watching TV every night. I mean, they might watch 10 shows on a Saturday and binge. They may not need it for a couple of months, but they just pay that monthly fee. So it's there when they know they need it. Similar to a cell phone, I don't use my cell phone the same every day, but I just pay that monthly fee. But when it's there, I can use it as much as I need it. And so those are two things that most people are really familiar with, and that kind of makes sense to them.
That's an interesting comparison. I haven't heard that cell phone one yet. Chris always says, when you say something we haven't heard, you get a t-shirt. So I guess that means you get a t-shirt in the mail.
I saw there was a question about town hall. I mean, I think I answered that, but we just advertised on Facebook and word of mouth and told people they could come. And we kept the presentation short. I think if you have PowerPoint presentations and they have more than like 5 to 10 slides, you're way overdoing it. Just a few slides and people will start asking questions. And once someone asks questions, someone else asks questions. So it's just a question and answer time. We had a sign up list that people could sign up if they wanted more information. They give us their email or their phone number. And we put that email in, and so
that's an important part. It's funny for me because people will come with these really great ideas of how to get the word out there, but then it's like, okay, it's happened. And then where are the names? So I love that you got, the list to follow up with. That's super important. If you're taking notes, write that down. It's awesome if you have a great event that gets that interest going, but it's not going to be helpful to you if you don't have the names. So a lot of times people like to do some type of a giveaway or, letting them know, that you'll reach back out with a promo code or something like that so that you're capturing those names to let those people know as you're growing. The next question that we had on our list here that we wanted to cover was what was your biggest challenge or some of your biggest challenges, if you had any, when opening?
Right.
I'm gonna guess you had one or two. And how'd you overcome them? What would you do differently? Tell us a little bit about that.
I think that, and again, people will say this, whether it's a DPC or just any entrepreneur, is fear of doing something different. Because I think human nature is, once you do something, you're comfortable with it, you stay in that rut, even if it's an unhealthy rut. And so I'll totally botch the quote, but you probably heard it before, where somebody had said, the pain of staying where you are has got to become greater than the fear of starting something new, or something like that. But you get to a point where it's like, I can't keep doing what I'm doing, so I've got to do something different.
Right.
But even when you decide you're going to do DPC or open a practice, there's that, you've got to jump, and you jump, you burn the bridges behind you and you go forward. And I would say that first year, I mean, you'll vary between a little bit of fear and a whole lot of excitement, and oh man, I just got 5 new patients today, this is great. And then 2 weeks go by and like, nobody's signing up, what am I doing wrong? You just have to realize that that's part of owning and starting a business. Be patient and just keep doing the right things, and word will get out. And so that was the challenge, I guess, was the fear. The other thing I would do differently, so you do want to get a website up and running before you open. You have to choose email addresses. My email address is way too long, and I never thought about that. I thought how cool to have your domain be SchumacherFamilyMedicine.com. But anytime someone asks me my email on the phone, I'm like, well, it's Dr. Joel at SchumacherFamilyMedicine.com. I have to spell it out for him. And I thought, boy, if I'd start over, I would keep it. That's a stupid thing, but it's
that's an easy piece of advice. Yeah. That's great. We like easy and free.
Yeah, right.
Yeah, awesome. Okay, very good.
And I think, like I mentioned earlier, a challenge is just recruiting. How do I recruit, and what's the best way to recruit? And I would love to have another physician or physician NP team or something, because the need is here in our town. There's 3 doctors retiring or leaving in the next year. And like I said, I already have a waiting list. So the field is ripe. If you want to be in small town, northern Indiana, we're right on an interstate and get to South Bend, Indy, or Chicago, Fort Wayne. We're right at the intersection. So it's nice, small town, but you have access to bigger cities. So yeah, we
Yeah.
need help.
Yeah, I hear that. I think I really like that you said fear as one of your obstacles, because most people don't think about that part. They think about the location, or someone saying, the hospital speaking out against them or something like that. And I think I think a lot of times people are just in their own way. And I think when you can just take that fear and jump with it anyway, I often tell people, if you don't feel like you want to puke a little bit, then you're not doing the right thing. Because this is, and a lot of docs haven't been entrepreneurs before. So they aren't familiar with that kind of roller coaster of emotions of like, oh my God, I'm so glad I did this. This is the best day ever. I actually get to see my patients. And then what was I thinking? Oh my gosh, this just happened. I'm the one who has to fix it. And it goes in waves. And I'm sure, as you can say, being in practice longer, it all starts falling into place and you get used to that as being kind of the norm.
Yeah. If you think about maybe a couple of the most exciting, exhilarating moments in your life, they're usually fear is combined with those, right? So
Yeah.
I say fear, but I don't mean that all in a bad way. That's exhilarating too, at the same time. So.
Yeah, that's awesome. Yeah, thank you for saying that. But what about today? We talked about the challenges starting up. What about your challenges today, aside from obviously your overflowing? What a problem to have of overflowing with patients, and your wait list is growing. What other challenges do you have other than that?
I thought about that, and nothing that's major. I mean, when I have a challenge, like I have a day like, wow, this was really busy. We had like 16 patients on the schedule, but that includes some lab draws and things like that. I look back to like, yeah, but we used to see like 30, 35, 40 on a busy day, during flu season. So just keeping it in perspective. But no, I mean, my life is good. I mean, I'm pretty happy with how things are now. I mean, there's challenges. I guess maybe just running your own business. I enjoy that part of it. I didn't know what I was doing, but I learned, and that's fun. But there are things I have to do that I wouldn't have to if I didn't run my own business.
I know a person who can help you with that.
I know, but I love it. So I wash my own windows out front. People drive. I'm in this small
That's
town.
awesome.
I love being downtown. Like there's like a 4-block area. And if
Yeah,
I walk to lunch, I have to stop and talk to the jeweler who's out
I
sweeping off the
love that.
sidewalk. And I stop and I talk to the florist, and I stop. So they kind of joke. My nurses joke that it's 5 minutes to walk and get lunch, but it'll take me an hour to get back because you have to stop and talk to everybody. But
Yeah,
they'll see me. I'm washing my windows, or I'm cleaning the bugs out of
yeah,
my lights, and it's a team effort. My nurses and I, we both kind of, up
yeah.
until about 3 months ago, we did all our own office cleaning too. I mean, we did all the vacuuming and
That's
cleaning
awesome.
every Friday. But as we got busier, I'm like, okay, I think it's time to hire someone to do it. So now we don't do our
Sure.
own vacuuming.
Yeah, I think I always like saying you're the cleaning crew, especially that first year. But I think at some point, then you're starting to measure how much your time is worth, right? And if you can hire and
Right.
outsource for cheaper than that, then that's usually where people get to. I just recently read this article. It's based on this whole book. I wish I could remember the name of it, but it was all about sidewalks and how important they are in our culture and in our communities, and how a lot of places aren't building them. And anyway, I won't go too far into that, but I love how you said that, because DPC is so relational. And often people will ask me, Sarah, I've got an opportunity in this city. Which one should I open in? And my question's always, well, where are you connected? Where do you love to be? Where do you want to be a part of the community? Because I mean, the reason for your growth and for your success is because of that, of being involved in that community, of being relational, of not being afraid to get out there and talk to people. I think that is the number one thing that impacts the success of a DPC practice in my mind.
Yeah. I think people in general are starving for
Mm.
human connection, for
Wow.
relationship. And what's happened to the medical community over the last 60 years is tragic, but it's kind of turned us into just a bunch of turning numbers, people in,
Mm.
people out as quick as we can, and because we're always running behind. But DPC has allowed me to slow down, allowed patients to have that human connection. And in a small, I think even in cities, but especially in small towns, people move to small towns because they love that connection. So if
Yeah.
you're the kind of person that doesn't want someone to say, hi doc, and holler across the street at you and wave.
Yeah.
And maybe small town is not for you, but most people, even doctors, they want that connection. And
Yeah.
so I think one of the questions you were going to ask is, how is rural different than a city? I've
Yeah.
not practiced city DPC, but I trained
Yeah.
there. And there's a lot of, people from the city who've moved to the towns, and it's a pretty mobile world now, I guess. So it's kind of hard to make generalizations. But I think a lot of my patients who are like farmers or small businessmen, they don't talk fast. I mean, they want to sit down and have a conversation.
A cup of
It would be
coffee.
really hard. Yeah, that's really hard to do when you have an 8-minute slot. But I
Yeah.
can do that now. And
Yeah.
one guy came in and he sat down with me, and his wife had made like some banana bread, and we had a cup of coffee. So that was we sat down in the
That
office
sounds great.
where we broke every rule with OSHA and everything. But hey, we had coffee and we had chocolate chip banana bread, and we chatted, and
Oh my gosh.
loved it. I loved it. And it's kind of like, I think a lot of people in rural communities, they hear stories about their parents who had the doctor that would make house calls.
Right.
They would just have that human connection.
Yeah.
And so they really love that. And that's what I feel DPC is kind of like the old 1950s medicine, but with
Yeah.
newer technologies added onto it.
Yeah.
So
Yeah. If you ever hear any webinars or any conversations with Dane Delozier, our COO, his dad was one of those docs. And so he often talks about that as his inspiration, and people just stopping by the dinner table and things. And we hear that a lot. I think that's one big piece that I hear with rural DPC different than, a bigger city, is exactly what you said. They're hopping by. Oh, hey, so-and-so needs stitches. Come by the house on your way home if you're not in the office. And I've got some funny stories about people trading fresh eggs for care. And, you get to be a little bit more lenient, I guess. But yeah, that's a great point. I like that. I think that also brings us to the next question pretty easily, of being on call 24/7. That's a question we get often. And that's another way I think it's a little more impacted in the rural community of when you do go to the grocery store and you see someone and they're like, hey, look at this wart, Dr. Joel, or how do you keep those boundaries to keep that happiness in your life that you're experiencing now with the balance?
yeah, I think the two things I would say about that. First of all, yeah, the people who just come up to you inappropriately at inappropriate times and feel like they can ask you anything.
Yeah.
I don't think that's just a DPC thing, because when I was working for the hospital, I just remember sometimes, like after church, you're trying to go out the door and there's 3 people lined up wanting to ask you their medical questions, or in the grocery store,
Yeah.
And I think that just learning as a physician, whether you're fee for service or DPC, learning to turn that conversation and say, that's really an important question. That's great. Hey, could you call my office Monday and we can talk about that, or we can get you in?
Mhm.
And most people get that and they're fine with it. Some
Mm.
people, you have to tell them 2 or 3 times, or say, this isn't fair to you, to just give you
Yeah.
my advice here. And
Yeah. Okay. Interesting.
yeah.
Um,
And then you asked about the on-call
yeah,
thing.
do you feel like you're on call 24/7? Do you feel like people are contacting you at all hours of the night, or how do you keep that boundary?
Um, I mean, I don't mind that. I
Mm.
mean, so yeah, I guess technically I am on call 24/7, 365, although I have a nurse practitioner who's wonderful, and she will take I can forward my phone to her if I'm gone on family vacation for a week or something like that. But up front in my patient packet I give people, I just say, here's some things that's appropriate to text me for after hours.
That's so
Here
great.
are things that are not appropriate. And if you do
Yeah.
this, you don't want me to burn out because I'm your doctor. So this is a mutual respect. I'm going to respect you and give you
Yes.
my 100% when you're here in the office or talking to me, but give me my time off too.
Yeah.
Um, if my wife was pretty concerned about like, how busy are you going to be? There's no one sharing your call. And
Right.
so when I did the math, I mean, when I worked for the hospital, there were about 8 of us that would share call. Each of
Mm.
us had probably 2,500 to 3,000 patients. I mean, I was carrying a beeper all weekend for potentially 20,000 patients, if you look at it that way. Now I'm carrying my phone for like 800 patients.
Mm.
And the difference is, if I get a call from somebody that I don't even know because there's some other doctor across town, that is so much harder to answer that than somebody that I know intimately. So I'd much rather take 3 calls from my own patients than 1 call from some strange patient. And so when I looked at it that way, it's like, yeah, this is a no-brainer. So I get probably maybe a couple of texts a week from patients. And it's usually moms who are just wondering, is this okay to wait till tomorrow for my kid or whatever? It's appropriate stuff. And so it's not been as bad as what I feared or what my wife
Yeah.
feared.
Yeah, I think there's always that one patient. There's always one that wants to test the boundaries. And as long as you do like exactly what you're saying, if you just set that precedent at the beginning, that will save you so much time on the back end if you can have those conversations early. I think that's usually really hard for people coming right out of working for a network and things as well, because you're programmed to be on all the time. And it feels a little bit selfish and a little funny at first, but you owe it to yourself, you owe it to your patients to be a whole person, and to your family, of course, as well.
Yeah, the other thing I didn't expect, I'd heard someone say this, and it was true for me when I first opened. There were, again, I'm back to the moms because they're concerned about their kids.
Yeah.
Boy, I had 2 or 3 moms that they would text me or they would call me a lot. They were just really nervous about their kids. And what I figured out was they were used to the system that if they called during office hours, they would not get an answer.
Mm-hmm.
So if they call the person on call afterwards, then they could talk to the doctor, but they couldn't during the day because they had too many roadblocks. Or if they waited till the next day, they knew they might not get in to see their doctor for a week, or they'd get passed off to someone else. Once they realize, if you call me like at 8:30 in the morning, we will get you in that day. It's almost like their anxiety level slowly melted. And so
Right.
they quit calling me at night and they just would wait till the next morning. So it was a learning process, but part of it was our fault as the medical community, how we trained patients to respond. So.
Yeah. Okay. Thank you for that. We've got a message here in the chat, Dr. Hodder. Hopefully I'm saying that right. Fresh out of residency, loving day 4 of my DPC practice in rural Illinois. Well, congratulations. You made it to
Awesome.
day 4.
Right.
The joy definitely outweighs the mountain of loan debt. Already about a third of the small town know that I'm the new doc in town, now working on my quick pitch to tell them how I'm different than what they're accustomed to. Okay, I'm really going to butcher this one. Dr. Glaucoma Flecken, rural medicine bids are my ideal picture of my practice. Okay, interesting. Have you
Have
heard
you
of
ever
that?
have you ever watched those
No,
that guy?
I haven't.
I think he's an ophthalmologist really, but he does a lot of hilarious
Yeah,
videos. He's kind of making fun of ourselves or of different
yeah.
specialties, but yeah, he's hilarious.
I figured with a name like glaucoma Flecken, he must have something to do with ophthalmology.
Yeah.
Uh,
Yeah.
so,
Well,
okay.
congratulations, Ben. I think that's great. I have a lot of respect for people who can do it right out of residency.
Yeah,
Um, someone else had a question in there about how do you recruit people over to DPC from fee for
yeah.
service? And again, I think the hugest thing is just fear of doing something different.
Mm.
Um, Most people, after they've been out for 5 or 6 years, they start to experience the grind and they feel like I'm out of control. I don't have control of my schedule. This isn't good for me, for my patients. Those are the people I think that you talk to and, have them come and spend a day with you or see like, wow, I can be like this. This is great.
Mm. Yeah, that's great. There's another question in here that asks if you feel that you practice broad scope primary care, and if so, how do you explain that to an unfamiliar audience, similar to what we were just talking about?
Broad scope primary care. I think probably it's a little easier to do that in a rural community than in a city.
Mhm.
And that's one of the reasons I chose a rural community, whether it's fee for service, insurance based, or a DPC, because we don't have a ton of specialists crawling all over the place here. I mean, we have a couple cardiologists. We don't have dermatology. GI comes in from out of town once a week. So we end up doing a lot of that broad spectrum care, I guess you'd say. So I do a lot of dermatology and we do skin IO, we do mole mapping. I do a ton of skin cancer removals, procedures like that. And I guess it's with DPC, you have a little more time to do those things. I mean, if you're seeing 30, 35 patients a day, you're kind of limited how much you can really do. But if you're seeing like 10 patients a day, you have time to do some of those procedures. So, if you really wanted to do, I mean, it's whether this is DPC or not, you can kind of, as a family doctor, focus on which procedures you want to do. But we do a lot of the basic ones here.
Yeah.
I don't know if that answers the question or not, but
Yeah, if not, feel free to throw another question in there to specify, and we'll grab that. I'm going to take 2 more questions here, so I'm just watching your time. I think, just to kind of piggyback on what you were saying, when I'm explaining to someone what DPC is, they still kind of look at me funny when I say that every now and then. Especially as a parent, I'm usually around other parents. I have 3 little boys, 10, 7, and 6. And I always like to start with, how much do you hate urgent care? There's nothing I hate more than urgent care. That is like at the top of my list. No offense if you're an urgent care doctor. I'm sure you're wonderful. It's not you, it's the system. But the fact that our pediatric office has been able to eliminate urgent care in my life has been amazing. Again, not every practice is like that, but I had a little boy bust his chin open last summer, and instead of going to the ER where he didn't know anybody, and maybe the doc there had never sutured a kid before or wasn't comfortable with it, we just walked into our DPC office 20 minutes later, and he wasn't scared. He knew everybody really well, was comfortable, got cleaned up, and sent on his way. It cost me the same. There was no additional charge for stitches there. So we just paid our $80 a month fee that we had at that practice, and it was included. And then after that, they call and check on him that night and then the next day. And, it's just such a different atmosphere. And I always joke about my husband being the most frugal person on earth, but he took a while for me to convince about DPC. And then when he realized we're paying less than we are with urgent care on a normal year and have such better care, it wasn't a hard sell. So I think using a story often helps when, you don't want to overload someone and do what I call dump trucking and tell them everything, but depending on the situation, especially if it's someone you know well and you're sitting down to banana bread or something, you can, tell a story about how it's affected your life or why you chose to practice the way that you did, I think is very helpful. Yeah.
I agree. For those who are thinking about doing that or who are building their practice, the story thing is so important. I was at the Free Market Medical Association meeting a couple months ago. I saw Chris Habig there.
Yeah.
And one of the presenters was talking about the best way to present. And he's the one that said, if you have more than a few slides, you're overdoing that. You need to talk about stories because that connects with people on a personal, emotional level, and that's what they'll remember. And one story is, like you talked about stitches. I had a patient who was a high school student, and he was playing in the band at the high school football game. They were goofing around. He wasn't looking. He bumped his head on some sign there, and he had to get stitches on his head. And so his mom texted me. They were patients of mine, and I just kind of zipped over at my office after the game. And so he and his buddy and his mom, they were all there. It was kind of like a big party there, but we stitched up his head, and he was laughing and stuff. And he posted it on Facebook the next day. And after that, people were like, "What? You didn't have to go and sit because they thought they were gonna have to sit in the emergency room for 3 hours late on a Friday night, mess up all their plans." But we had him up in 30 minutes and he was out the door. And like you said, there's no extra charge for that. And I enjoy doing it, and they were thrilled. And then they go and tell their friends about it. So
Right. I think it's a common misconception that people think when you get that type of care, you're paying so much more money. So just, emphasizing that accessibility also is so important. I've got one more question here asking about, would you ever consider joining another DPC vendor? Not sure what that means. Or are there more benefits to managing your own practice? You talked a little bit about owning your own practice and the fun there, and I can weigh in on this for sure, but
yeah, I'm sure you will weigh in on this too. So before I answer that question, I saw one other question about DPC members. How do they fully capitalize on it? And you're right. It's just have to tell them over and over again. And in fact, I just got an email last night from a patient. They've been patients for 4 years, and he just asked me, "Do you guys do stitches if I'd ever need those?" I'm like, "Oh, I've been telling you, yes, you do." It's just, that's human nature. Yeah, we do. I can send out a blast email. I usually do once a month if there's anything new in the practice, or just reminding them which number is the right number to call for different things. So just constantly re-educating patients. And you can put little things up on your wall when they come in that says, "Hey, we do immunizations or we do sutures." So yeah, the vendor thing, I think what they're talking about is, since direct primary care has been going, there are some little companies popping up that all of a sudden they start emailing you saying, "Oh, let us come work for us. You know, you're a DPC doctor like MD VIP," or there's a lot of them out
Oh,
there
okay.
that are these companies that are kind of like venture capitalists, or they're entrepreneurs themselves, but then they're employing doctors.
Mhm.
And while I think that's better than what the alternative is, which is staying in the insurance system, of course, because I'm owning my own business, I prefer that, because all I want to work for, all I want to work for are my patients. You
Mhm.
know, my mission as a Christian, I'm working for God first of all, but I'm working for my patients.
Mhm.
And I don't want the insurance telling me what to do. I don't want a hospital telling me what to do. I don't want MDVIP, and I don't mean to pick on them, but they're the first one that comes to my mind. But all these companies popping up that want to employ doctors. Um, Now, I consider Freedom Healthworks a little different, because you're helping doctors still be independent doctors, but you're kind of helping them set up, or they're becoming
Right.
kind of part of that. Um, but you know what I'm saying? I'm like,
Yeah.
I understand if someone's like, if the fear of starting and running my business is too great, I'm going to have someone help me. That's okay. It's better than where you are now. But you went to medical school. You got in, you got through residency. You can do this. You're smart enough to do this.
Right.
And it feels like, oh, you're swallowing from a fire hose. But if you break it down into small pieces, all those little pieces, you can do it. And there's people to help you, other DPC docs that will, or there's a place like Freedom Healthworks that can help you. Um, but my advice would be not to join those big groups that are claiming to be DPC. There are a lot of hospitals now too that are seeing, hey, this is becoming the hot new thing. We'll run our own DPC. It's like, I would not go work for a hospital DPC, because you're going to be in the same situation, in my opinion.
Yeah, back to RVUs and yeah.
Yeah,
I
too
think you're
many
right.
rules, and yeah.
Yeah, I'll clarify a little bit there on what Freedom does. So it's really important to us at Freedom that you're the doc. We like to say we stay out of the exam room. So we want you to practice the way that you want to practice. What we exist for is to help you on the business side, so that you can do like what Dr. Schumacher is saying, is focus on those patients, be there for them, and not be worrying about the admin side at the end of the evening when you need to be with your family. So that's one way. We have two, sorry, my mailman's coming through here. We have two different options for that. So we can help you on the independent side, like setting up a practice like Dr. Schumacher has, where it's your name and it's your logo on the business and you're making those decisions. But we also offer some practice management services where we can support you on that back end before you're ready to hire in person. And then we have another pretty new option for you called Freedom Doc that we launched last year. There's loads of webinars and podcasts that I'm happy to send you, diving in more. We can just hop on the phone if you want to hear about that. But it's similar to that. We found that there was a big missing piece where people wanted to start their own practice, but they couldn't afford that amount of time without an income, or maybe they need to work their current job now and while they're launching their practice, and keep doing both at the same time, so they don't have the time to go through and find each piece for each step. Or like, I like to compare it to building a house. They don't have the time to go look at YouTube and figure out how to lay the foundation and then put the windows in and all of those things, so they hire someone else to do that for them in the background. And we're there to both support that side, but also the business side. So when you come in as a Freedom Doc, what we do is it's under the name Freedom Doc. It has all of our branding. You're basically walking into like a turnkey office. You're set up, your medical supplies are ready, your vaccines are ready, everything's ready. We just need you to see the patients, but we don't employ you. That's really important to us. We don't want to employ doctors. We want you to be the owners, and it's more of a partnership. So we can talk through more of that later. I don't want to turn this into a Freedom Doc webinar. I want to keep focused on that rural DPC spot, but somebody set me up for a good question there.
Yep.
All right. I think that is the end of our questions. If anybody has other questions that they would like answered, whether it's about rural DPC, DPC in general, either of us would be more than happy to speak with you. Dr. Schumacher, where can they reach you if they want to check in with you after?
Yeah. People can feel free to email me. Again, that email is
Yeah, what is it?
Dr. Joel. Is that a really long one? Dr. Joel, DRGAOEL. Schumacher Family Medicine. SCHUMACHER Family Medicine also .com. And I
Really,
and I'll
but you
respond.
can't forget that because
I
it's so
know,
long, it sticks out. So maybe you did the right thing.
maybe it's just a long one to type. Yeah.
Yeah, and
But yeah, I'm
for
happy to answer any questions if they come up later, or if someone's watching this in the future and they want to email me, I'm happy to.
okay, awesome. And for those of you who are listening to this on the back end, we'll be sending out that email that came with your recording. We'll have that information for how to reach Dr. Schumacher, and then also myself if you do have any other questions. And I always like to just add a little disclaimer on the end here. While we are a company with services and we want to support you in that way, whether you use our services or not, we're here to help you get connected and get the resources you need, because our ultimate goal is getting as many DPC practices as we can going as soon and as efficiently as possible. So please don't hesitate to reach out, and stay tuned for more fun webinars coming up this summer. Thank you so much, Dr. Schumacher, for joining us. That was so helpful, and we really appreciate your time.
Thank you. Have a great weekend.
Bye.